Hi everyone, I'm Valerie. Today we'll be talking about in utero exposure to endocrine disruptors. We'll talk about exactly what they are, how you can become exposed to them, symptoms of diseases, current issues within the health field, and what you can do to prevent exposure to endocrine disruptors. So let's get started. So what exactly are endocrine disruptors? They are chemicals that mimic hormones and bind to estrogen receptors. This leads to hormone disruption and birth defects. Endocrine disruptors have many different terms. They are often referred to as xenoestrogens or endocrine disrupting chemicals. They are important in the manufacturing industry and used in many consumer goods, such as plastics. Examples of endocrine disruptors are chlorinated hydrocarbon pesticides, polychlorinated biphenyls, and bisphenol A, which we will further discuss. Bisphenol A is more commonly known as BPA. BPA is a major endocrine disruptor. It acts like estrogen but antagonizes the thyroid hormone, which affects metabolism and can lead to weight gain. It is a carcinogen, meaning it can cause cancer. Two main cancers caused by BPA are breast and prostate cancers. BPA is used in polycarbonate plastics such as food and beverage containers, toys, eyeglasses, computers, and medical equipment. It is also used in epoxy resins such as dental materials, food cans, and pipes. An individual can be exposed to BPA in many different ways. The primary source of BPA exposure is ingestion through diet because of food containers manufactured with BPA. BPA can also be inhaled through the lungs or absorbed through the skin. Workers in direct contact with BPA have a higher risk of exposure. Another high risk of exposure is intrauterine, from pregnant mother to fetal child. Traces of BPA have been found in blood, urine, saliva, breast milk, and amniotic fluid. General symptoms of exposure to BPA include infertility, weight gain, diabetes mellitus, increased aggression, and anxiety. In males, two possible birth defects caused by BPA exposure are hypospadias and cryptorchidism. BPA exposure can also lead to poor semen quality and quantity, as well as higher susceptibility to prostate cancer. In females, susceptibility to breast cancer is higher, and those born with intrauterine exposure are more likely to experience early menstruation. Since 2011, 10 states have passed laws that limit the use of BPA in products for children. In June 2011, American Medical Association identified BPA as an endocrine disruptor, and on March 30th, 2012, the FDA decided that there is still not enough data to ban BPA in consumer goods. It has been argued that low doses of BPA have no significant effect on the population at risk. Although BPA hasn't been banned yet, there are ways to prevent the health risks of BPA. You should limit your exposure and intake of BPA whenever possible. You can reduce your use of polycarbonate plastic food and beverage containers. You should also avoid microwaving or dishwashing those plastic containers even if they claim to be dishwasher safe. You could also substitute canned foods for fresh or frozen foods. And lastly, you should look for products labeled as BPA free. Thank you for watching and have a wonderful day.